We're doing a really good job screening for those that are at the highest risk for falling after leaving here. The tool is newly developed. From the beginning of their admission at St. Charles Rehab all the way through the end, we know who's at high risk, and we're going to intervene to keep patients as safe as possible after leaving here. So we used the Six Sigma methodology. We reviewed about 240 records, 120 patients that fell after discharge and 120 patients that reported not falling. And we wanted to compare those two groups to see what the patients that fell had in common. We used those factors to develop a post-discharge fall screening tool that's completed by the physical therapist on admission. So anybody that has 3 or more of those factors is deemed high risk. That tool is used to really implement individualized interventions for fall prevention.
Once these patients are identified as a risk, or whether they believe they're risk to not to be, education is provided by the social workers and the rest of the interdisciplinary team, and allows them to regulate what they believe to be at-risk behavior. And we were able to reduce the amount of falls from the year 2018 to 2019. And then what we were able to do is we were actually able to build in the tools for the FESI tool, as well as some of the falls risk identifiers into our EMR and capture those for greater need and greater data collection as we went through the process. The nature of a hospice patient is that continually decline in the community. What happens is that family members don't see the decline and don't see that risk behavior in an elderly family member that's trying to get out of bed, trying to use the bathroom. So seeing this up front, we actually produce a falls kit that we actually give to at-risk family members, and in it is a night light. There's reflective tape, there's booties that have the non-skid bottoms to it, and it's all part of our ongoing education. So implementing something like this where we could actually take a multi-year approach and say, let's study what was going on and why this was going on, and to actually be able to identify a program that was non-nursing, that allowed us to look at what at-risk behavior truly meant from a patient's perspective, not from our perspective. So this program really does identify their perspective of whether they believe themselves to be at risk or not, and then being able to do something to implement a program and the tools, giving tools to somebody so that they can see it in themselves.